Hey, this is Dr. Bisanga. I'm going to talk today about mega session in hair transplant. I have no conflict of interest to disclose. What is a mega session? Depending on clinics, some will say mega session is actually moving more than 3,000 grafts in one sitting. This number varies from clinic to clinic or for practitioner, but I would say between 2,500 to 4,000, depending on a clinic. This can be considered as a mega session. What are the requirements for mega session? The requirement for mega session, you need to have a well-trained staff. It can be really heavy, and so you need staff that are well-trained. In our clinic, we take a ratio of 5 to 600 grafts per trained tech to avoid fatigue. And you have to have a team that can handle a high graft count in a reasonable time frame. You don't want the team to be there for more than 16 hours. Otherwise, the next morning, they'll be on their knees. So the patient for next day will not get the benefit of having a fresh team. What are the advantage of a mega session? So you can limit the number of hair transplant that you do over time, because you're going to move a great amount of graft in one sitting. And for me, the advantage is also a good donor management when you combine techniques. Can you do FUE, FUT, body hair for mega session? It's important that the first criteria for any hair transplant will be donor density. If you look for bigger session, if you have to add FUT, you need a good donor laxity, but the number of hair per follicular unit, what we call the calculated density, it's important so you can have a meaningful result when you have to do this big nose scale. In case you're going to do combo, the height of the donor will also be important, the age of the patient, because if the patient is younger, half of his donor may be gone 10, 20 years down the line. So you cannot really do a mega session on a younger patient because half of the donor may not be there in a couple of years. The degree of boldness also, because the biggest the boldness, the greater the number of grafts that you're going to need. And also, I always say realistic expectation. If someone wants a hairline at 5 centimeters from the eyebrows, it's not going to make sense if they know it's 6 or 7. What are, for FUE, the criteria? The criteria, again, good donor density. I would say 80 follicular unit per square centimeter and up. Always keep in mind not to over-harvest, because over-harvest will lead to donor being poor, because the remaining follicles will either be shrink or miniaturized after a heavy session on FUE. Less miniaturization in the donor. Donor height, as I say, 5 to 8 centimeters, that will be great. Patient over 30 years old will also taking DHT blocker. For me, 3,000 to 4,000 grafts can be harvested in a donor without over-harvesting and without compromising donor integrity. A safe harvesting protocol is important by leaving intact follicular unit between each harvested hair, and obviously using an appropriate punch size to not injure peripheral follicular unit. For FUT criteria, you need a good donor density, good donor laxity, a team that can handle slivering, dissecting graft and placing graft. There's no upper limit really when it comes to FUT, but the most important is laxity will be the limitation. The complication of mega session, you can have donor over-harvesting. So you have to be careful by not just scoring the great number without keeping them in mind the over-harvesting problem. You can create a lot of donor scarring and poor growth if the time outside the body is higher, so that you may consider using different storage solution, maybe PRP or some hypothermosol or the fancy storage solution. I like to do FUE body hair and FUT together